Welcome in. Thank you again for joining us for our webinar Wednesday. Today's topic is how to manage the impact of MS on your mental health. This webinar series is brought to you by Can Do MS. My name is Brianna Ghostin, a Can Do manager with Can Do MS, and I will be your moderator for tonight's evening. I want to take a brief moment to thank our generous sponsors for supporting this year's webinar series: EMD Serono, Genentech, Sanofi, Beatrice, Zenas Biopharma. Thank you again to our sponsors. We have some upcoming virtual programs we love for you to attend, including a new Take Charge program on building your tool chest that will be taking place this Friday, along with our monthly Jumpstart and Your Questions Answered that will focus on the topic of mental health. So we hope to see you there. I am thrilled to introduce our amazing speakers for tonight. We have Dr. Shameka Mills, who is a neuropsychologist in Baltimore, Maryland. We also have Dr. Joshua Johnson, who is a psychologist in Washington, D.C. Thank you both for being here, and we are excited to learn from both of you. You have heard enough from me, and I will hand things over to our speakers, Dr. Shameka, who will introduce our learning objectives for tonight.
Hi, everyone. Good evening. My name is Shameka Mills, and I'm a neuropsychologist in the DC metro area. I'm very excited to be here. So today our learning goals are: one, to recognize the range of emotions that people with MS and care partners can experience; to recognize the impact of emotional changes on communication in daily life; and to become familiar with options for managing emotional changes. Next slide, please. So since we're talking about the association between multiple sclerosis and mental health, I think it's good to start with a definition. What are emotions? So according to the American Psychological Association, or APA, emotions are conscious mental reactions, such as anger or fear, that are subjectively experienced as strong feelings, usually directed toward a specific object, and typically accompanied by a physiological and or behavioral change within the body. Now, that's a pretty long and wordy definition for just emotion, so I want to break that down a little bit. And I want to start by noting that the word feelings is within the definition of emotions. So usually when we talk in our day-to-day life and for the rest of the presentation, we use emotions and feelings interchangeably as if they're the exact same thing. But they're actually not. There's a slight difference between the two, and they're associated with one another, but they're not exactly the same. So emotions are a reaction to an event. Something happens, and there's a reaction. An emotion also induces or causes a physical and chemical change within our body. And this is not necessarily something that we can recognize. So a chemical change might be if there's an increase in cortisol. Cortisol is a hormone that's related to stress. Another chemical change might be if our body releases extra neurotransmitters like dopamine or serotonin. Those are two of the more common neurotransmitters that are associated with happiness and depression. So there's a chemical change that happens. But there may also be a physical change. And the physical changes are the things that we can usually feel, we can experience when it happens. So if your muscles become tense, that's a physical change. If your facial expression changes, that's a physical change. If your breathing or your heart rate changes. So we have an event happen, there's a chemical change, there may also be a physical change, and then those things are then experienced as a feeling. So the feeling is a subjective experience of an emotion, and it's layered. There are other things that influence the feeling. And this might be your past experiences, this might be your cultural values, social norms, how you interpret a feeling, or excuse me, how you interpret the emotion. Next slide, please. So if we're talking about emotions cause a physical or chemical change within our body, we're basically saying that emotions originate from our body, originate from our brain specifically. So if any of you have ever looked up, just Google like a picture of the brain, a lot of times a cartoon will come up and the brain will be divided into these different sections. And from the pictures, it looks like that different parts of our brain work in isolation, but that's not really what happens. Every part of our brain works with multiple pieces, multiple other parts of our brain, and we call these systems. So the limbic system is a system within our body where there are several different, a system within our brain where there are several different components that are responsible for regulating emotional and behavioral changes. And I don't want to go into too much detail about this, but I do want to just highlight a couple of main components of the limbic system. So we have the amygdala. This is an area of our brain that is responsible for dealing with fear, anxiety, anger. It evaluates any types of threat and initiates an appropriate response to them. So, for instance, people who suffer from PTSD, you'll see high activation of the amygdala. There's also the hippocampus, and the hippocampus is mostly known for where memory function occurs, but it's also the area that connects our emotions to our memories. We also have the hypothalamus. The hypothalamus is known for regulating hormones, including stress hormones such as cortisol. So these are three parts within the limbic system that are related to the occurrence of emotions. But there are also components outside of the limbic system, so other areas of the brain that are also involved in this process, such as the prefrontal cortex. This section of the brain evaluates situations and helps us choose what is the appropriate emotional response based on that situation. It can also kind of go through, well, what are the potential outcomes if I express emotion A versus emotion B? So, how does this relate to MS? If we think of MS lesions, depending on where the lesions occur, can affect your mood, can affect how your emotions are expressed, can affect your ability to choose what emotion to express or even how to evaluate a situation. This partly explains why why within MS, why in MS, I'm getting a little tongue twister, you can experience mood swings, why there are high rates of depression, why there are high rates of anxiety, why there are high rates of pseudobulbar affect. Pseudobulbar affect is a phenomenon where you might have crying or laughing that is inappropriate to the situation or uncontrollable. So, for instance, if someone gets hurt, you start laughing, and you might know, oh, I shouldn't be laughing, but you can't necessarily control it. Or maybe there's something that is funny, but where maybe you would have a little giggle or a little chuckle, now you're rolling on the floor because it's just so funny. Next slide, please. Okay. So even though our emotions originate in our brain, it is not all about the brain. There are so many other things that come into play. So in this diagram, we have a situation in the center, and then it's surrounded by thoughts, feelings, physical reactions, and behaviors. And there are lines that are connecting all of those, no arrows. And that's because all of those things influence one another and influence how we feel. So what I think is going to influence how I feel. How I feel is going to influence any physical reaction or response I might have. That physical reaction may then influence how I respond or the behavior that happens. But it can also go in any direction. So my feeling will influence my behavior will influence my thought may influence a physical reaction that I have. And all of those things are influenced by environmental factors. Environmental factors could be, again, cultural values, societal norms, what has a past experience told me how I should feel about a situation? What have I learned from the past to tell me how I should behave in a situation? So our emotions and feelings originate in our brain, but then they become multi-layered based on all of these other factors.
All right. And so Josh here, I'm a psychologist out in the DC area. Kind of building on what Shameka was sharing, we know that these emotional changes that occur for MS are due to a lot of different factors. As Shameka mentioned, the lesions that affect the brain in people with MS directly affect our emotions and can affect people kind of down the line. We also know that living with MS, the challenges of that, reacting to those challenges can also cause emotional changes. It can be difficult to experience that and add to frustration, anger, depression, and so forth. But it's also important to note that if someone had any pre-existing conditions, like they already were feeling depressed or already experienced anxiety prior to being diagnosed with MS and adjusting to that can make those challenges kind of even more prominent or more intense. We also want to let you all know that it doesn't only affect the person living with MS. People, including the care partners or other people in people's lives, are also experiencing the adjustments of living with MS and how that affects the system. And so it's important just to pay attention to that.
So as we continue through this presentation, we're going to be talking about different types of feelings, different types of mental health diagnosis, and it's going to be pretty normal to think, oh, does this fit me? That sounds like me, but I'm not sure. And it's perfectly natural to have those types of thoughts, and you might think it would be easy to identify if you fit something that we're talking about, but it's not exactly as easy as you would think. It can be really difficult to identify what feeling or emotion someone is having for several reasons. One, emotions are subjective. So what I feel about a situation may be very different than what another person feels about a situation, even if we experience the same situation in the same time at the same time. So I can't use someone else's feelings to assume that that's exactly what I'm feeling. Also, our emotions are dynamic. They fluctuate and change over time. So you might feel one thing first thing in the morning, but perhaps throughout the day, you've spoken to someone, you remembered a past event, you had a new experience. So by the time you go home at the end of the day, you feel completely different about the situation. And you might feel differently, several days later. So our emotions are always changing. They're also multifaceted. So thinking back to that first diagram that we looked at where there were feelings, thoughts, behaviors, and then a physical reaction, all of those things, again, influence what it is that we're feeling. So it's not just one thing. Again, thinking multi-layered. And then our emotions are mixed. So rarely, I don't want to say rarely, but oftentimes we're feeling more than one thing. So for instance, I could be very excited about this presentation, but I also get nervous for every presentation, right? So I have two feelings at the same time about the same thing. And a lot of times people will say, oh, I feel some kind of way. Usually what that means is they're having multiple emotions at one time, and we kind of have to filter through to figure out what those different emotions are. So what are some common emotions in MS? And Josh is going to go into more detail about them, but just to give them some titles: sadness, depression. Depression is extremely common in MS. Per the research, up to 50% of people with MS will experience at least one depressive episode. And we'll talk about what that means, a depressive episode. Worry and anxiety is also very common. It's number two. There can also be irritability, grief, which we'll talk about a little bit, frustration, and then confusion. And there might be some confusion about, well, what is this confusion about? You have a new diagnosis, you have all of these medical providers, all of these treatment options, everything that Google tells you, everything that other people tells you, and that can lead you to a state of confusion. What does all of this information mean for you? What does it mean for your family and your future? So confusion is also a common emotion that people do feel. These feelings can also they can be directed at yourself, but they can also be directed at other people and other entities, right? So you can have irritability towards the healthcare profession, for instance. You can have frustration at MS, for instance. So it doesn't necessarily have to be a feeling that you have um, towards yourself or towards another person. It can also be feelings towards an entity.
All right, and so I'm going to spend the next section talking about the difference of like an emotion versus a true mood disorder. As we've kind of highlighted, emotions are normal human experiences. We all have them, and they serve a purpose. It's normal to have emotions that can change based on the circumstances. Mood disorders are more so mental health conditions that we can experience that are more extreme. They can cause a lot of distress, and they impact how we function and live. Often these last extended periods of time, so several weeks to months. And so I use the metaphor of an emotion like sadness might be like a rainy day, but a mood disorder may be more like an extended rainy season. It's lasting a longer period of time than natural. And so to go kind of into an overview of the different mood disorders someone may experience, I want to kind of highlight just some commonalities across them. Many mood disorder symptoms look a lot like MS symptoms. People experience sleep disturbance when they have mood disorders, similar to MS. Fatigue is pretty common, as well as difficulties of concentration. It's also not uncommon to experience multiple mood disorders at the same time. We call these comorbidities or comorbid conditions. And so you might be feeling depressed and anxious at the same time. So one class of mood disorders that is pretty typical for people with MS or any kind of chronic medical condition are adjustment disorders. The DSM-5-TR, which is our diagnostic manual that we use to diagnose medical conditions or mental health conditions, defines adjustment disorders as emotional or behavioral symptoms within 3 months of having been exposed to a stressor. That stressor can be something at work, a medical condition like MS, but this can cause significant distress and or affect relationships, work, and so forth. And so for people with MS, adjustment disorders may come about due to being diagnosed with MS, kind of taking that news in, changes in roles and relationships. Maybe you were once very active or very involved in the family, but have to kind of take a step back because of the condition and how it affects the body. Changes in ability, as well as adapting to symptoms changing from one day to the next or over time. And so people can kind of have adjustment disorders that go off and on when symptoms also change. And we know that not only can the person with MS develop an adjustment disorder, but also their care partners because they're kind of along the journey as well. As we mentioned earlier, depression is pretty common for people with MS. There are a lot of different estimates on how common it is, but we do know that people with MS have higher rates of depression than the general population. One very large study, we use what are called meta-analyses, which kind of compile different studies together. It estimated about 27% of people with MS had depression. But as Shamika mentioned earlier, there's also estimates that say up to 50% of people with MS may experience depression at some point in their lifetime. This is a comparison to the general population having in the US, having about 8% of adults having at least one major depressive episode in the past year. So usually we define depression by episodes, like periods of time, but it can kind of come and go for people. We call that more recurrent episodes. As we mentioned, depression is more than just sadness. I'll go into some symptoms that are pretty common for depression that we should kind of pay attention to. And for people with MS, depression can be due to the MS lesions themselves, like how it affects the brain, as well as just adjusting and coping to MS. But the good news is that once we recognize it, it can be treated. And so this is the criteria that we utilize to diagnose depression. And as you know, low mood, like sadness, things like that, is one of the symptoms. However, it's more than just like feeling sad for a day, it's lasting a longer period of time. In addition, you can either have or by itself experience what's called anhedonia, this lack of interest in things that used to bring you joy. You might have really enjoyed gardening, being out in nature, and things like that, and just can't find the energy or interest to do that anymore. That's a pretty hallmark sign of depression. So you need at least one of these two things to be diagnosed with a depressive episode. But additionally, you can experience things like sleep difficulties, fatigue, changes in appetite and weight, feelings of guilt, worthlessness, or shame, difficulty concentrating, moving kind of sluggishly or being really fidgety and restless, or even thoughts of suicide. And so I wanted to bring those up because there's a lot of overlap again between what someone may experience with MS and what might be depression. Sometimes it's kind of hard to tease them apart. And if you do experience thoughts of suicide, please do not hesitate to call the crisis line number. In the US, it's 988. It's really simple, 988. You can also call 911 and call the emergency department or go to an emergency room. Anxiety also is pretty common, and anxiety disorders are kind of a large umbrella in which there are little different types of anxiety that we kind of want to pay attention to. We know that up to 35% of people with MS may experience anxiety based on a large meta-analysis that looks at a lot of different studies kind of combined. And just like depression, it can be due to lesions in the brain that cause this, as well as just adjusting to the fact that there's a lot of uncertainty with MS. You might feel great one day and be worried that you might not feel great the next. And that can bring up a lot of anxiety and confusion and concern. And similarly, care partners may also develop anxiety because they're also dealing with that adjustment. Or if the care partner is a family member who's genetically related to that person, they might also fear developing MS. And so, as I mentioned, there's a lot of different types of anxiety disorders. I won't go into all of them, but one that I really wanted to highlight was health-related anxiety because it's not uncommon when someone has a chronic medical condition like MS to be really anxious about their health. You might pay a lot of attention to your body, thinking like, oh, is this a symptom of my MS? Or maybe it's just like my what's kind of going on in my thoughts. It might also be that people become avoidant and stop engaging in their healthcare. And so it's really important to kind of pay attention to how you engage in your healthcare because your anxiety may affect that. Some things to kind of pay attention to, some symptoms to kind of look out look out for that are kind of across anxiety symptoms. Our features are the way you think. You might have thoughts like, I'm a burden to everybody, or I can't handle this. Your body may start to react when you feel anxious. You might feel more tense. Your heart rate might increase. You might have a shortness of breath. And your behaviors will start to change potentially too. So becoming more avoidant, misusing healthcare, arguing with people. Just some things to pay attention to. Other things to consider, they're not necessarily like disorders, but maybe just things that are pretty common for people with MS who are developing some changes. Becoming more irritable. With MS, it's draining people's energy when they're fatigued, and so then you have less energy to tolerate different stressors you normally might be able to tolerate. And so you might become more short or angry. And I just want to highlight that anger isn't necessarily a bad emotion, it's how you use it. Other things that are unique to MS are kind of like what Shamika mentioned earlier, the pseudobulbar affect, but also euphoria, having a lot of energy, feeling really happy all of a sudden. It's kind of like out of context with the environment, or being disinhibited, spending recklessly, engaging in like risky behaviors, just things to pay attention to because that might also be a side effect of MS and this effect on the brain.
So up until now, we've really just kind of focused on MS and people who have MS, but a lot of the diagnosis that Josh went through, anyone can experience for any reason. Depression, anxiety, irritability. Yes, the rates will be different, but any of us can experience them. And sometimes care partners forget that they also have emotions too. And as mindful as they are of their loved ones' feelings and what they're going through, we want them to be mindful of their own as well. Josh mentioned bad emotions. Sometimes we talk about good emotions and bad emotions as if they're completely separate and forget that all emotions are normal. So it's not necessarily that there are good and bad emotions. They just happen along a continuum. And what's really important is what do we do once we recognize that we have emotions? We definitely don't want to ignore them, right? Ignoring them increases the risk of potential consequences of not addressing them. So sleep disturbance, either sleeping too much or sleeping too little. And that was kind of a common symptom that Josh mentioned earlier. We can also increase our vulnerability to illness, right? If we are stressed and we're not addressing that stress, that affects our immune system. If our immune system is affected, that makes us more vulnerable to colds and flus and anything else. We can also develop maladaptive coping strategies such as isolation or increased substance use. So we definitely don't want to avoid any emotions that we have, whether you are the person with the MS or the care partner. I think it's also important, and we've said this a couple of times, that emotions are normal, right? They're things that we all experience. They're things that make us human. So we have to remember that they're allowed. We're allowed to have these emotions, whether we consider them a good emotion or not. All of our emotions are valid. If you're angry, that is a valid feeling. And all of our emotions are important. And it is worthwhile to address them. And as we've said a couple of times, it's not necessarily that we have the emotion that can be the problem, but what are we doing with it? And how can we use that emotion to make them more effective? So what are some common emotions that care partners report? And this is not a complete list. There are many more, but I just wanted to highlight a couple of them. So the first one I want to highlight is ambivalence. And ambivalence is when you have conflicting feelings or thoughts simultaneously about the same exact thing. And this creates what we call cognitive dissonance, which is basically stress because you're kind of being pulled in two different directions between what you feel and or what you're thinking. So an example of this could be like sadness and relief. So perhaps you're sad because your loved one is in too much pain and they can't go out, they don't want to go out. But you're also relieved because maybe you didn't want to go out either, or you didn't want to put forth the effort that it would take to assist. So it's conflicting feelings about the same exact thing. People also report feeling embarrassment, and embarrassment can happen in so many different ways. But what's commonly reported is feeling embarrassed about not being able to provide what is assumed to be adequate care. So your family member, friend, loved one needs something and you feel as if you should be able to provide it, but for whatever reason you cannot. Something that I hear a lot of times in my practice when I work with patients who have memory problems or behavioral changes, their family will say, oh, well, we're in public and they're asking the same question over and over. Or we're in public and they're disinhibited, meaning they just say things or do things without acting and they become embarrassed by that. Grief can also be experienced, and typically we talk about grief within the context of the passing of a loved one, but we also we grieve changes. And this is where Josh mentioned adjustment disorder a little while ago. This is sometimes where adjustment disorder comes into place. So if your role has changed in someone's life, your relationship has changed. So we can grieve that relationship. We can also grieve a change in identity. We can grieve a change in what we thought our future would be. I'm going to come back to guilt at the end. So I want to switch to the next column and talk a little bit about jealousy. Jealousy is also commonly reported. So if you think, someone else has the freedom to do things that you can no longer do. Someone else has less responsibility. Someone else has more time. You might also feel jealousy in your loved one with MS. Maybe they're getting more attention by other people. And of course, these aren't feelings we want to have, but again, feelings are normal, so they may be there. People also report feeling loneliness. And I like to remind people that you can be in a room full of people, you can be in the living room surrounded by loving family and still feel lonely within your experience, still feel unsupported, still feel as if other people don't understand what you're going through, or just don't have a common experience. So you feel alone within that experience. And there can also be resentment. And as I mentioned earlier, sometimes we can have feelings towards something. So there can be resentment towards MS. There can be resentment. Why my family member? Why are they going through this? They don't deserve this. Why me? Why us? And I wanted to go back to guilt because at least in my experience, guilt is something that almost everyone expresses that they feel, partly because of all of these emotions that they feel they should not feel, right? No one wants to feel jealous. No one wants to feel anxiety. No one wants to feel embarrassed. And then there's some guilt that they actually have these feelings. And even though right now we're focusing on care partners, what often comes out in working with families is not only do the care partners feel guilt, but also the person who has MS feels guilt as well, just about something different. So, it's we kind of lay it all out on the table. What are we all feeling guilty about? Let's discuss this so we can hopefully reduce the guilt. And then sometimes guilt is reported, again, similar to the example I gave with embarrassment, feeling guilty that perhaps the care partner cannot provide the level of care that they think they should be able to provide. All of these feelings, if not addressed, can lead or contribute to caregiver burnout. So it is really important that we try to manage them as much as possible. So now that we know that we can have all of these feelings, we have to figure out what feelings are people actually experiencing. What am I feeling? We want to go beyond fine, okay, and good. These are elevator terms, right? You go into the store and the cashier says, how are you doing? You say, oh, I'm fine. That's not what you want to say to yourself. That's not what you want to say to your family. So how do we go beyond fine, good, and okay? So this is a handout that I use at work. And I make my patients use it. Literally, I make them use it. After the first couple of sessions, they are not allowed to say they're fine. They are not allowed to say they're good. They have to choose one of these, or they can choose another one, but they have to say they're feeling confused, they're feeling proud, they're feeling silly. Let's identify our emotions. The first step in processing them and managing them is to actually identify what they are. So let's say we need to go beyond this. So we've said, okay, you're sad. We know you're sad, but that can mean a lot of things. Next slide, please. So this is an emotion wheel, and I know it can be a little small, so I hope you can see it well, but in the center we have our 6 core emotions, and these are emotions that are cross-cultural, meaning regardless of where you're from, regardless of your country, your native language, we can almost always identify these emotions pretty easily. Angry, sad, happy, right? We use emojis for these. We can usually look at someone and recognize if they're angry or if they're sad. But then if we take it a little bit further, if someone says, okay, I'm feeling sad, well, are you feeling hurt? Are you feeling despair? Are you feeling lonely? It digs a little bit deeper. What's the underlying feeling beneath sad? And then we can actually take it a little bit further. Are you feeling abandoned? Are you feeling fragile? Are you feeling empty? Right? Really kind of hitting it. And this is where for some people, therapy can get really difficult because now we are really going beyond the surface level of what we're feeling. And we are kind of digging in. I tell people, well, let's start nitpicking of what you're feeling. Let's talk about that feeling of emptiness and what's contributing to it. So let's say we've identified what it is that we're feeling. What's the physical sensation that goes along with that? And sometimes for some people, it's actually easier to start with the physical sensation because that's tangible, right? You know what it feels like when your muscles are tense. You know what it feels like when your stomach is in knots. So sometimes we start with number 2. But what's the physical sensation that you have? Sometimes people don't know. They know they feel different. They don't feel like they want to feel or normally feel, but they don't know what they feel. So I like to do what's called a body scan, and it's just a mindful activity, and it's just having people sit. If it's an ideal situation, they can close their eyes and really just focus in on what their body is experiencing. Where do they feel tension? Do they feel tingling? Do they feel tightness? What are you physically feeling? And then what's causing this feeling? And this might be some trial and error. So you know that event A happened. Let's go through that event. Is that event in some way related to what you're feeling? Maybe. Okay, so let's put it to the side. Event B also happened. Is that relating? Event C also happened. What's contributing to this feeling? Usually there are patterns in what types of experiences makes us feel a certain way. So it's always helpful to kind of go back and kind of go through your history a little bit. When was the last time you felt this way? And what was that thing that contributed to feeling that way? And then the last thing, and this is the big one, is okay, well, what do I do with it? I know what I'm feeling emotionally and physically. I know why I'm feeling, but I don't want to feel this way. So how do I manage it? How do I cope with it? And this is where, of course, therapy can be helpful, but also we're going to look back at your past experience. This is probably not the first time you felt this way. So what happened in the past to make it easier? What did you do in the past that made it worse or made it the same? We can use good and bad experiences to figure out what to do next. At some point within this process, though, at any point, we hope that people feel that they're able to communicate it with someone, right? Communicate it with a trusted friend, a trusted family. So how do we communicate what it is that we're feeling and experiencing with our families? Next.
All right, so that's a perfect segue into, like, we've talked a lot about emotions, but we also want to talk about how we can use these effectively, how we can kind of give you all tools to navigate your emotions very effectively. And the key thing is communication. Remembering the goal of communication is to share information between 2 or more people. So it's not only what you receive or understand, basically what you're taking in, it's also what you're sending out or expressing. Communication is really crucial when living with a chronic illness like MS because you're interacting with a lot of different people. You've got your care partners, healthcare providers, family and friends. And they all have their own communication styles as well that can affect how well the communication will go in the future. And when it comes to our emotions, that can impact how effective we are when it comes to communication. When someone's depressed, they might shut down or be more negative, and so it might be harder to kind of get them to share what's going on. When someone's more irritable, they might be short or harsh and not listen very well. Or anxiety can make it so that someone's seeking out a lot of help or become more avoidant. And so communication is not only the verbal, what we say, our actual words, it's also these nonverbal things. Most of what we communicate is nonverbal. We lose a lot over text, we lose a lot when we don't look at our body cues. And so things like body language, eye contact, facial expressions, tone of voice can really change a message. I could say, for example, thanks for the help. And it's not taken in the same way as thanks for the help. It might come up more sarcastic. And so, one of the best ways that we can communicate is by being assertive. This is one way in which we can respect ourselves by being direct about what we feel or what we want, while also respecting the other person and allowing ourselves to receive and not diminish the other person. This is way different than being aggressive, where you might put your needs over somebody else's, or it's opposite, being very passive, where you kind of shrink yourself and let the other person have the run of things. Being passive aggressive kind of undermines yourself as well as the other person. You're not really sharing what you feel. You might kind of undermine the person or talk around them. This can help with care providers where you or physicians where you don't really want to share what's going on or how you feel. And at the end of the day, both people are losing out.
Okay. So, what do we do with all of these emotions that we've talked about? How do we manage them? The main thing I think is don't forget you, right? In our day to day, we are so busy. We're managing a lot: work, family, chores, tasks, responsibilities. And a lot of times we put how we're feeling off to the side so that we can address something that we feel is more important. We either purposely do that or it's just by accident. And again, by not addressing these things, we run the risk of one, making them worse, but then developing maladaptive strategies, things that we don't want to do, things that will absolutely make it worse. We want to recognize again that our feelings are normal. We're supposed to have feelings. It is okay to have feelings. It is absolutely okay to not be happy all the time, to not be calm all the time. And once we can recognize that it's okay to have these feelings, we want to forgive ourselves for having them. We should not feel guilt. Although guilt is a normal feeling, we should not feel guilt because we feel angry or because we feel sad. It's not that we have the feelings, is what we do about the feelings. What can we do? We can ask for help. And there are many ways to ask for help, right? You can ask for help by saying, hey, I just need someone to talk to. Do you have a moment to listen to me? Or I really need some time to myself. Do you think you can pick up this prescription so that I can just take a minute? Families, friends, anyone that you feel comfortable with. If you don't want to share with someone within your natural system, join a support group. You know, we're lucky enough to live in a day where we have access to the entire world through our computer. What's available out there? Where some place that you can go where you can talk to someone, where you can find some type of relief. If you don't want to do that, keeping a journal. There's no right way to keep a journal. I think sometimes when you say journal, a lot of people kind of get a little bit nervous. Oh, I'm not going to write every day. I don't know what to say. It doesn't matter what you say. It doesn't matter what you write every day. And if writing is difficult, you can keep an auditory journal. You know, record yourself. What is it that you want to get off your chest? You can do an expressive activity. What helps you get your feelings out? Do you like to dance? Do you like to bake? Do you like to sing? And physical activity. Of course, if it's approved by your physician, physical activity has many benefits in terms of improving our mood. It can also help improve certain types of pain. You just want to make sure that it's something that is not going to be harmful for you. The main goal is we want to reduce avoidance, right? We want to address whatever it is that we're feeling. We want to make sure that we're not isolating, that we are not repeatedly engaging in unhealthy eating or in substance abuse, or any other maladaptive strategies that can unfortunately just worsen the situation. Excuse me. And at any time, you can seek the assistance of a mental health professional for many different things. So, of course, psychotherapy, and there are many different providers who provide therapy, not just psychologists. So many different names. Social workers do therapy, therapists do therapy. So we can provide counseling. We can also do assessment. So let's say you don't like what you're feeling, but you're not exactly sure if you should address it or what's going on. You just need someone to kind of, get you a starting place. We can do that. Someone mentioned in an earlier question, so I want to quickly address it in terms of like cognitive assistance. If you think you're having changes in like memory or language, or if you're concerned if what you're experiencing is normal aging versus MS, you can always do a neuropsychological assessment, and that's where we actually look at your memory, look at your thinking skills, and we can piece out if you're having these difficulties and what are some of the things that are causing these difficulties. And then lastly, a mental health professional can help with medication. So you know that you are depressed, you're beyond sad, and nothing is working, and you're curious if there's a medication that would be helpful.
All right. And I want to provide a list of just different interventions that people who often in therapy, we utilize these different interventions to help people cope with different emotions and disorders. And so I'm not going to go through all of them. I will go over one, but these are just some things that can be very helpful to cope and learn different ways of responding to emotions as well. So one thing that can be done really easily and really simply is a grounding skill. And I'm going to go over one really quickly. And so grounding skills are great because what they do is that you can do them anywhere, anytime. They help bring you back into the current moment so you can respond very effectively to your emotions as best as possible. This one's called 5, 4, 3, 2, 1 because it's about naming 5 things in your immediate environment right here, right now that you can see. Looking for 4 things that you can feel, like the temperature in the air, the seat beneath you, your skin or your clothes, things like that. Looking or listening for 3 things you can hear, either outside the room, inside the room, or just around you. And as it gets more complicated, 2 things you can smell, so you have to pay a little bit more attention. And finally, 1 thing you can taste. And so you can do this anywhere, anytime, and no one has to know you're doing it. And so I just want to thank you all for being here, and we'll go to Q&A.
That was amazing information that we just received. We love to hear your thoughts. As a reminder, we will ask you to complete a survey that will pop up at the end of your screen, be at the conclusion of the Q&A. But before then, let's get to some of your questions. So one of the questions that we did have that popped up in the Q&A is, can emotions be affected by side effects of meds people take?
Short answer is yes. All medications have side effects, everything, even things that you take over the counter. So if you've noticed that there's been a change in your mood and you think it's related to a new medication or some type of change, I would always go first to the referring provider and say, hey, I've been on this medication for a couple of weeks. I've noticed this change. Is this something that I should be experiencing? Let them tell you first. And if they say, no, that's not really common, then we can start looking at other things that might be contributing to it.
I'll just add to that. What can be helpful is when you start something new or add something new to your regimen is to kind of create a timeline or like note things day by day. So you can kind of start to notice patterns because that helps us as providers kind of say, yes, it's this, or maybe it's not.
Brianna, can I answer one question that I saw on here? I'm sorry. There's been a couple of comments about PBA, the pseudobulbar affect, and I did not read all of them, but someone did ask, what can you do about it?
Okay.
As far as I know, there's now one medication that is approved for pseudobulbar affect, Nudexta, I think it is. There are off-label SSRIs are sometimes used for it. So, of course, it has to be diagnosed. So you want to discuss it with your provider, but there are medications to treat it.
Thank you so much for answering that one. One of our next questions is feeling overwhelmed an emotion or a reaction to something or an event?
I would say it's gonna be both in the sense that you can feel overwhelmed and maybe not always know what the cue is and not really know like what's driving it, but you feel that way. And so you have the right to feel that way. Sometimes you can kind of pinpoint what's driving it. And so then that's the response to what's going on. So the emotion still might be that you're overwhelmed. You may or may not know what's causing it though.
Okay, and then the next one we have is, as MS progresses, what do I need to be aware of in regards to my mental health?
I think regardless, you want to be aware of what's changing. Um, One of the first diagnoses that Josh mentioned was adjustment disorder, and it's really just about things are changing and now we have to adjust to it. So, how are things changing for you? What are you noticing? Do you find yourself becoming more depressed? Do you find yourself becoming more anxious? Or even in the opposite, do you find yourself feeling more gratitude or more hope? The more mindful that you are about how you're feeling, and either, using a journal and kind of tracking that, the more aware you are of what's going on for you, both emotionally and physically.
I'd also add to that when we think about like mood disorder specifically, it's how that's affecting your functioning. So are you like not doing things that you used to do mainly because of your mood or maybe not just because of the MS? And so you need to think about how that's affecting like your sleep, your like engagement with things and so forth. So if you notice yourself like withdrawing socially or not doing hobbies, that's something to be mindful of. And there are things you can do to kind of keep track of that as well. There are like apps or like websites that have screeners you can use to kind of check every now and then how you've been feeling. And you can track your mood over time to kind of help you say, I notice it's been low for a long time. I might need to pay attention to that and bring it up to my providers.
I'm seeing a lot of questions in the chat about your grounding exercise. If you could go through it again real quickly, some people are just asking about that.
Yeah, so this is a really good exercise. So it's naming 5 things you can see, and you can change up what order you do it in, but usually it's 5 things you can see. So in front of me, I see my computer, I see a flashlight, I see a cup, things like that. It's 4 things you can feel. So things that are in your immediate environment that you can feel, like the temperature in the air, your clothes, the seat beneath you, things like that. um, 3 things that you can hear. And so the goal is to get harder. You have to pay more attention to what's going on right now. And so I can hear like the neighbor above me, for instance, or I can hear sounds outside. 2 things that you can smell, and 1 thing you can taste.
And then we
Brianna,
have another question. I am a newly diagnosed. What support and recommendations would you give someone in protecting their mental health now and moving forward?
I think for anyone who's newly diagnosed with any type of chronic disorder is to be as proactive as possible. In general, I'm just a proactive person, right? So even if I don't immediately recognize there's a problem, I want to figure out, well, what can I do to address it if there becomes a problem? So looking at what are support groups? Do I want to consider therapy? What are my coping strategies going to be? It's always easier to plan for things when they haven't occurred versus now everything is there and you have to figure out what to do. Um, a lot of hospitals, pre-COVID, a lot of hospitals had different support groups. Now everything is online, which is still great, right? You have more access, but kind of setting up those things as early as possible. And then you can decide, okay, well, I don't need it, but I know where to go if I do. So your plan is already set in place.
Josh, would you like to add to that?
Yeah, I think on top of it too, it's just kind of being mindful of like your mind body interaction. Our mind and body are really connected. And so, like maintaining your health, getting good sleep, being physically active, those can really help in managing your mood as well as your overall health, as well as like just staying involved in things. So, like trying to not withdraw as much as possible. Trying to keep up with your normal activities as much as possible, but adjusting them. So, one of the things that we often teach people is what's called pacing. It's kind of slowing yourself down so that you can still do things, but do it in a way that doesn't overwhelm you or stop you from really enjoying life.
And Brianna, I'm sorry, just I noticed a couple of people asked about the emotion wheel. So it should be in the presentation that you'll have access to, but also if you just Google emotion wheel, there will be so many that pop up. Most of them are very similar. Like they all have those 6 core emotions, but then whatever's on the outside of the wheel may be different. Some of them have handouts that will go with them. So if you just Google emotion wheel, you'll get several too. If you're unable to access the one in the presentation.
And we will put the link back in the chat of the presentation, which will be located on our dashboard. Another question that we did have is, can MS fatigue impact mood and mental health?
Yeah. So fatigue in general can impact mood and mental health. Chronic fatigue can definitely impact mood and mental health. So, and other things as well, right? So, but I'm sorry, I get excited with some of these questions. My apologies.
Passionate, and we love it.
I am. So I always kind of think of like this little triangle at work. So there's like this, we have cognition, right? Our memory, language skills, everything that goes into thinking. Then we also have our mood. So, are we happy? Are we sad? But then we have these outlier factors, right? Are we sleeping well? Are we in pain? Are we tired? All of those things affect one another. So if I'm really tired, how is my mood going to be high? Right. But also, poor mood can make me feel more tired. They have this bi-directional relationship where they affect one another. And sometimes it can be difficult to figure out, okay, well, am I tired because of the MS or am I tired because I'm feeling depressed? And we can all say, well, I'm so tired. I don't want to do the things that will make me feel better. But in actuality, it's trying to do those things, even if it's like at a reduced intensity or maybe 10 minutes versus you used to do 2 hours, it's doing those things that will actually lift your mood. And if you're able to lift your mood, you might actually improve some of the fatigue a little bit. So it's kind of like this double-edged sword, and you want to try to build on both at the same time. So addressing fatigue with your medical providers, but also figuring out how much of this fatigue is related to the mood. And probably at least some of it is.
And I think I saw somebody in the chat mention acceptance and commitment therapy, or ACT. It's a really great form of therapy that focuses on doing what matters even when things are difficult. And so it's not undermining the fact that this is hard, that there's a lot of challenges with like chronic illness and so forth. And also we want to find ways that people can still live their lives and move forward. And so I mentioned pacing earlier. It's a really great skill for fatigue, because it's sometimes people who have chronic fatigue, they are like, I feel great today. I'm just going to do everything I've been trying to do for days. And then they crash because they've burned themselves out, especially if you haven't been active for a while. And so the goal is that you might do less each day, but you're doing more over time. And so it's trying to think a little bit smarter so you can kind of work for a longer period of time, engage in more things. And so, like Shamika said, it's that balancing act.
Yeah. And there are handouts online too that can walk you through how to pace yourself. Fatigue pacing, pain pacing is a thing too. Put it in Google. There will be handouts that pop up on how to do it. It's just important. Sorry, Josh said earlier, like I think you said monitoring yourself. How are you feeling? It's just important to monitor how are you feeling and not overdoing anything.
And I think having great conversations like this also help as well. Another question that we had was, one of our participants indicated having an anxiety disorder and was curious to know, can you have multiple mood disorders?
You want to address that, Josh, since you talked about it?
Yeah, it's not uncommon. It's actually more common than not to have more than one mood disorder at the same time. They can often feed into each other. So if you're feeling depressed and then because you haven't been able to do much, like you might start to feel anxious because you're like, oh, I'm so far behind. And then it just kind of feeds, it's a chicken egg situation. And so oftentimes it's more often than not that we're seeing more than one mood disorder at the same time. But often the treatment is very similar or starts to build upon each other. So again, it's not unusual. How we approach it can really address both at the same time.
And I think the last question we will go with is, when it comes to mental health and managing mood, when is it time to ask for professional help?
Anytime. Honestly, anytime. Again, I'm just a proactive person in general, but a lot of people wait until something has happened. And you don't have to wait for something to happen, right? Everything can be fine but it's just a way, a place to go where it's non-judgmental, unbiased, where you should feel safe, right? Where you can engage in a trusting relationship and talk about what's going on in your life and hopefully get feedback. There's no time that is a bad time for therapy, whether things are perfect or whether things are more challenging.
Mhm. Yeah, we often are in our field are promoting like episodes of care. So you might go to an episode of care where you're like, I want to just get some skills to kind of get ahead of like anxiety or stress, just know how to be able to cope with it before it gets too severe. You might go when you have like a major life event, and so you'll be the expert of that. A therapist or any other mental health provider wants to work alongside with you, and so being able to recognize like I might need some help now, and not waiting before it gets too hard or too far along is usually really great for you. And I saw people asking like therapy professionals, health psychologists, especially those who have experience with MS, are often great places to look for, and like Psychology Today is a great place to look.
There's also, I just want to add on to that. There's a therapy technique called a 1 day. I might be getting it completely wrong, but it's basically like a one therapy session type approach, right? So maybe you're not sure if you need therapy or if you should be going to therapy. I think it's like single session therapy. And they really operate on a single session approach. And then sometimes those providers will say, well, single session isn't really appropriate. Let's do something more. So there are options out there. And I think someone mentioned like I don't know what I read earlier, but at any time you can just go and say, I don't know if this is what I need. Can we figure it out together?
Mhm.
And that's completely valid too, right? You're not expected, none of us are expected to know everything.
Yeah, and many providers will offer like brief consultation to see if they're a good fit for you
Yeah.
or if you're ready for it. And so you can always reach out to the provider and say, hey, this is what I'm going through. Would this be a good fit? And they can work with you.
We do want you guys to stay connected. The webinar may almost be over, but we would love for you to stay connected with us on all our social media. Again, we want to say thank you to our sponsors, and as well as our speakers for all the information that they've given us tonight. And then our next upcoming webinar will be June 11th, and it will be on the topic of managing bowels and bladder issues. We hope to see you there. Thank you so much. And remember, there will be a survey popping up. We would love to hear your thoughts. Have a great night, and thank you for joining us on our webinar Wednesday.